Dr. Eileen Marti joins me now. She's a professor of infectious disease and an outbreak response expert with the FIU Herbert Wortham College of Medicine. She's in Miami Beach, Florida today. Dr. Marti, great to have you with us again. So Arizona, Texas, and Florida together reporting about 25,000 new coronavirus cases after all those months of people being in lockdown. This is where we are. What do you make of this? And perhaps more importantly, where it's going?
Well, if we continue on this path, we're going to completely exhaust our system. Our hospitals are completely overwhelmed. Our ICUs are at the max. And the reality is hospitals cannot operate at 100% capacity continuously. It's a staffing problem. Our staff is overwhelmed, and it's going to get bad, and we're going to have unnecessary deaths. And you asked me also, why did this happen? It happened because we basically squandered the lockdown. During the lockdown, we did not manage to convince our population to cooperate in such a way that they would follow the new normal guidelines, practice the 6-foot distance, wear the mask, clean your hands, right? Respiratory etiquette, all these basic things. We did not manage to convince our population to do the right thing. And in the meantime, we didn't get enough of a system for contact tracing with appropriate questions out and to sufficient quantity so that we could capture every case. And we couldn't even do that because we never got the turnaround time for the testing and the amount of testing necessary up to the levels that we need to contain this outbreak. So it's a multi-pronged problem, and this is where we are.
And now we have corporations like Walmart taking the lead. They are saying you have to wear a mask, and yet we're not hearing it from public officials, doctor.
That's a failure. That's a failure of not having a consistent, reasoned, evidence-based approach to a public health problem. If you don't manage a public health problem with public health tools and instead rely on emotion or innuendos or all sorts of things that do not work, you head towards disaster. And that's what's happened to us. We need a whole of government approach, a whole of population approach. Forget politics, put that aside, and do the things and give the right message to the population so they understand that everyone has a role to play in order to get the numbers back down so that we can have a rational economy, a safe living, and possibly get the virus out of our community.
Do you see any glimmers of hope?
I see some politicians finally recognizing the dangers of their prior positions. For example, the governor of Texas with the mask mandate is moving in the right direction. Here in Florida, in Miami-Dade, Mayor Jimenez is absolutely committed to making the right moves. We have Congresswoman Mercoselle Powell pushing to help people who need help and providing the funding that's necessary, working with Congress. There are a lot of people trying to do the right thing, but it's not, you can't have individuals by themselves. It takes all of us, and we have to come together as a community in our counties, in our states, and in our country, and hopefully in the whole world, because the enemy is not an individual, it's a virus. It's a submicroscopic particle that's simply causing havoc to our lives, to our health, and to our economies.
Dr. Marti, thanks so much. All the best to you. We'll speak with you again.